Okay, great. Thank you very much, Steve, and thank you very much to the organizers for asking me to moderate this next session. Given that you're all in the room, I'm assuming you're sold on the idea that scaling up nutrition is one of the best things we can be dedicating our energy towards when it comes to development. I'm also assuming that you're sold on the idea that the first 1,000 days are indeed the most critical time period when it comes to targeting an intervention in this respect. We're going to come at it from quite an interesting angle, which is how business fits into this picture. It's not a new debate, but it's a debate that I would suggest is gaining some serious traction at the moment. And we may be witnessing quite an interesting coming together here of the public and private sectors when it comes to development, not just in the field of nutrition, but across the board. Before we get into the discussion, let me just say a couple of words on the format. We're going to start with Steve Godfrey, who's Director for Investment, Partnership and Advocacy at the Global Alliance for Improved Nutrition, who's going to say a few words, and then we're going to go into a fairly straightforward panel discussion. In essence, we have 4 speakers. We have 4 examples, practical examples of using market mechanisms and using business to address this issue of nutrition. And we're going to explore those examples and look at both the positives but also the difficulties and issues when it comes to trying to bring business into this debate, but much more importantly, what needs to happen in order to take things to the next level. On that note, I'd like to ask Steve to make his opening remarks. Thank you.
Thanks, Lanre. Can I have the first slide up, please? Yeah, so I just quickly, I think the most important part of this session is the actual case studies. But we in GAIN have really been, over the last 10 years, managing quite a lot of public-private partnerships around these business models in 30 countries for staple, fortification, condiments. And then we recently did quite a detailed evaluation of our early MIYCN interventions. And I thought we would maybe kick off by just trying to give you not case studies in terms of quoting or citing those, but a sort of synthesis, a very high-level synthesis of some of the outcomes of the assessment or analysis around those 10 years of business models trying to introduce nutrition through market-based channels. So, I mean, this is pretty much a standard framework, but those are the criteria which we've looked at: impact, scale, sustainability, and potential for replication. When we looked at our various experiences, and obviously we're trying to get from, sustainability impact, but get it at scale. If I could have the second slide. I think the typical earliest experience we had really was of a national food fortification alliance, which was really a multi-stakeholder platform with government at the center, the industry for the relevant staple, their community organizations and so on, really working together to introduce fortification. But in general, particularly around the more targeted fortification, which is the newer area, we've identified in our own work 4 or 5 different types of models that go from a purely commercial down to a more of a social impact, social business model, to a subsidized commercial model, which is kind of a hybrid, right into a government service model. I think we talked a little bit about India yesterday, for those of you at the Business Alliance, where we're trying to reshape public supply and social protection programs, right through to programs that are kind of more or less fully charity-backed. Observations and kind of reflections, these are in some ways helpful, in other ways they're unsatisfactory because there's not much specific detail to them. But first of all, I mean, we've learned that putting in place and enforcing legislation and regulation, that where the projects have had awareness and involvement of the governments early on, that's really been quite significant to success. And I think we talked about governments having their hand on the steering wheel in some, that's the thing. Secondly, the behavior change and the demand creation are really the critical challenges here. First, the behavior change, much slower than expected uptake of solutions when introducing products that require behavior change, needs a longer time horizon, more effective interventions, and learning about that is something important. And then from the kind of demand creation side, which is the other part of the coin, the other side of the coin, the 3 to 5 year typical project timeline is proved to be inadequate. we're talking 5 years plus. And I think yesterday, again, Sam talked about that, sticking to your knitting, staying with the course, because it is quite difficult to do this. And then other general observation, a tendency to kind of over-ambitious goals. We found that often the projects develop market entry scenarios that are actually much more ambitious than even you'd have in a standard industry benchmark project. So that's the sort of some general comments. Secondly, differentiation in terms of the type of project. Obviously, the population-based ones are different. I think around staples, again, you heard yesterday, scale has been achieved. The model looks pretty vibrant, pretty robust, and potentially quite successful. Big challenges reaching the last 20%, significant issues around quality assurance, quality compliance, and some issues, which we didn't go into a lot yet, around volatility of prices, where the price of the premix can become, after a subsequent successful exercise, a new barrier. People find that they don't want to have to cover those costs. I think for the kind of 6 to 24 months market, which is where many of these projects we're talking about have come in, I think all projects are regulated in their marketing activities, and at a minimum they respect the code of conduct, on breast milk substitutes. But I think we need to there is a real issue which was talked about in the session just prior to this. I think there was a question from a colleague from Ireland, which Martin, I thought, answered very well. There is a real issue around that question of how we expand the market for complementary foods, because there is this short-term problem of very high levels of stunting, which are reproduced on an annual basis. And I think another major obstacle for those types of projects is just that the market is cyclical and small. And that's a big, big barrier. It's not a market that once your consumers, part of your business income, is going to be there in 2 or 3 years' time, by definition. In terms of reach, I think we've learned that leveraging existing distribution networks is the best way to do it. That's clear. Where you already have a distribution network, whether it be through an NGO or commercial network, it's much better to build on the back of that. But on the other hand, that's a kind of inherent limitation, because where we've been successful, or where we think we're being successful, like the ICDS in India or some of the work in Bangladesh where we're using BRAC. I mean, BRAC is not exactly an institution that's replicated across the world. It's a very unique Bangladeshi institution. So many of the projects that are successful seem to be based on local circumstances, which it's quite hard to generalize and replicate. I think in terms of projects that really rely on hybrid systems or work with WFP, NGOs, where there's a supply to government programs, that's great because you get a solid demand curve. It's reliable. But of course, you're always potentially dependent on a single large customer, which is a risk. Money. Finance, follow-on investments. I mean, we clearly don't really have a grasp on how to work from small projects or projects that are pilots that are potentially successful to match the money for post-piloting investment. Too many, I think, of the projects are a level below the radar of lending institutions. And then also on the money side, the volatile raw material costs. I mean, they can play havoc with the economics of these projects, because very, very few of these projects are high return projects. They're not, 10 to 15% return on investment. They are 2 to 3%, and you have to wait a long time. So the economics can be quite challenging. I think that's really all I would say for now. There are management issues. I think most of those probably we've already discussed. They're not really very surprising about, aligning with your partners, having a good base. Most of that is pretty much obvious without need to focus on. So I think, Lanre, rather than spend a lot more time, I apologize. We can make more of this information, and we'll make more of this information available with a bit more granularity around the actual projects. But since those projects are not here, it's not easy to talk about them because they're not here to speak for themselves. However, you have 4 very talented presenters who are going to give you the information. Thank you very much.
Great. Thank you very much. No, still not on. Okay, there we go. Thank you very much, Steve. Right, I think the best way to do this, first of all, probably to introduce the panel. To my immediate left, we have Samuel Ntim, who is the CEO of Yedent Agro Processing Ventures in Ghana. To his left, we have Fokko Wientjes, who is the Director for Corporate Sustainable Development at DSM in the Netherlands. Then we have Kate Hencher, who is Technical Advisor, Population Services International USA. And last but not least, we have Yasuhiko Toride, who is Director of Nutrition Improvements Projects, Associate General Manager, R&D Planning Department at Ajinomoto Co. in Japan. I'm very conscious of time. We've got about 50 minutes or so by my watch. Effectively, what I'd like to do is to ask each of the panelists the same question. We're going to focus on case studies here. This is about sort of looking at the practicalities of business, bringing business into sort of the issue of nutrition when it comes to development. And what I'd like to ask each of the panelists in turn maybe is to, one, speak of their experience, i.e., what, by way of a practical example, should we be looking at? But then also, and perhaps much more importantly, speak to the issue of, well, what are some of the challenges? What needs to happen in order for things to move on? What needs to happen in order for things to build to scale and so on and so forth? Because while this convergence of public and private sectors in development is something that is gaining some attention, it is quite a tricky relationship to get right. Maybe we'll just start. You have the misfortune of sitting to my left, so you unfortunately have to go first. 3 to 5 minutes or so addressing this. So what's your experience been? What have you learned out of that? What really, by way of challenges, by way of issues, should we be looking at, should we be thinking about, should we focus on?
Thank you. I'll look at 2 themes towards scaling up. The theme of business approach and the theme of business models. Practically, I have seen 3 approaches that has enabled us to look at scaling up. First approach is sole private sector business led by our own experience. We started something on our own into the market. Then private sector approach, where through us and a combination of other private sector businesses, there's been a product into the market. Then public-private sector partnership approach, that is between us and gain. So these approaches are live experience approaches in our business. Then what are the models through which we get onto the market? We have 2 clear models. The direct distributive marketing models that use demand and market approaches, demand and supply. Then we are also looking at the non-distributive market, where we deal with institutions and like the Ghana Health Service, World Food Program, and all those organizations too. But I want to talk strictly about a distributive market trade, where our market models, using the direct distributive channel, manufacturer, wholesale, we do complement that with direct market selling, which is tailored along our socio-cultural marketing environment. Then these 3 approaches that I mentioned earlier has also enabled us to develop products that has enabled us to increase the product in our portfolio basket. Because when we started alone, we have only 1 product in our portfolio basket. Through the GAIN public-private partnership, we have another portfolio. And through the private sector, we have another portfolio. So these approaches have enabled us to have enough product in our portfolio. The last thing I want to talk about is our communication model. In our communication model, we have direct marketing, advertising, and social marketing advertising. That is also underpinned by the approaches that I mentioned earlier. For instance, GAIN helped with the social marketing aspect, where the orientation and the mindset of mothers and caregivers were really communicated to for them to know the benefits of nutrition, while we'll also personally drive our advertising. These approaches and models together have enabled us today to have more products in our portfolio, communicate to a lot of people, and deliver some volume and quantity which on our own could never have been made possible.
Great, thanks a lot. And you say some volume and quantity. Are you happy with the volume and quantity you're able to deliver, or would you like to see more?
Oliver Twist will always ask for more.
Okay. I think there's an answer in there somewhere, but we'll get back to that. Moving on to our next panelists. Fokko, your perspectives, your experience. I see that you're Director of Corporate Sustainable Development. That sounds eerily similar to CSR. Is this simply CSR, or is this a little bit more that's going on here?
No, sustainability for us is actually one of the core growth drivers for the company. I mean, there's so many issues out there. If you look at things like climate and energy, if you look at health and wellness, if you look at the global shifts, urbanization, etc., then I think there's so many challenges to look at a more sustainable supply that for us sustainability is not CSR, is not just philanthropy or being nice, but sustainability is actually a growth driver. When I was thinking about this panel, actually 4 things came to mind. That is, and I'll explain them later. That's global, it's a moving target as a second one, that's the consumer, and last but not least, I think we're preaching here to the converted. Global, I think we need to very much look at where is the best point on doing this. Food is very local. There's of course a couple of examples of global foods, McDonald's being one of them. So we need to decide what do we do at what level, and I think that Sam's example is a perfect example that we need to do things certainly local where we can do it local. That was also said in the previous panel by the representative from Kenya, is please help create jobs, of course also in our country. So I think that's one deliberation that we have to make, global versus local. Second is moving target. The trouble is that the whole supply chain is so much still in development, and we still are faced with huge moves into huge urbanization still going on. That means actually that the distance from farm to fork is actually increasing. And by the way, an additional complication is that the people close to the farm are also malnourished, but that's a separate item. So that's the second thing, is the moving targets. We're still very much in development, so we still haven't reached the end stage where we can optimize. We're still developing. The third is the consumer, because the consumer is not on board. If you and I walk into a shop and we see a fortified product versus a non-fortified product, roughly the same price, we'll probably go for the fortified product. That's not the case still in developing countries. I think that's also what I said yesterday, is we need to look at what is pre-competitive here. I think some of the things, and I think also Sam's example where he's been helped by GAIN, shows that some of the awareness we need to treat as pre-competitive. So that's probably something where I would invite all of you to respond on. And then the fourth is a very obvious one. If I look at the partnerships that we have and the business dealings that we have in this space, the majority actually is in the room here. So that's not a good sign, because that should not be the case. Or this room should be much, much bigger than what it actually is. So if I see the sort of the critical success factors for me is agility, adaptability, and that also has to do, if we look at the Sun process, and today is a Sun Business Network Day, that is trust. Because we still see that there's, of course, If I look at it, what is needed is we need local entrepreneurs, we need global intrapreneurs, people like some of you representing large companies. Internally, you don't have an easy task because the business cases are certainly not always there yet. So there's a lot of convincing needed. And we need trust, which probably means transparency. So we need to agree on, with civil society, with government, is where do we need to be transparent about? Why is there always that issue of trust or distrust coming around the corner? Now, to look at them, what works, and then actually, to be honest, what works is the very stable, large-scale stuff that we've been doing so far, and that is stable food fortification. So where do we really reach large groups of beneficiaries with products that is in large flour fortification programs, oil fortification, sugar fortification. DSM is bringing a new fortification opportunity to the market right now, which is rice fortification. And that goes into different types of, if you look at Steve's slide with the 5 different models, that goes into different areas. That goes from government programs all the way through hybrids to just offering on the shelf fully commercial. So you'll find fortified products in all the above. Of course, we've made great breakthroughs in reaching sort of the poorest with our cooperation with the World Food Programme. That has been really a breakthrough where we are reaching millions and millions of people with improved nutrition. So that helps, that's good, that's scale, because that's what is needed, is scale. It needs to be really, really big. And if I look then at what we are doing in a more innovative side, then, well, the example that we are a supplier to Sam's company is one. In Zambia, we've worked with the World Food Programme to look at voucher systems. And I think voucher systems are very important. What I said earlier is the consumer. Right now, if you have a beneficiary and you try to turn a beneficiary into a consumer, that's very difficult. If people have been getting stuff for free, there is no desire to buy. Very practically speaking, when I was in Nepal a while ago, where we, together with the World Food Programme, have been distributing, when we asked women there, would you buy? They looked at us and said, would I buy? With a big smile on their face. No, of course not, because you get it for free. So to get from a donation model into a purchasing model is very difficult. And I think that the voucher system is one where you actually make that purchasing decision. In the 80s, New Zealand changed their whole system from free schooling, free hospitals, etc., into a voucher system, and then turned all the citizens into at least sort of lookalike consumers, because now people were making a consumption decision, they were making a purchase decision to go to a certain hospital or go to another hospital, and the funding of that hospital was depending, of course, on how the amount of vouchers they got in. So I think that vouchers are an extremely important sort of changeover to get beneficiaries into consumers. Indonesia, we're looking at the, that's a corporation where, for instance, also Rabobank Foundation is involved, where GAIN is involved. We're looking there, can we do street market, so street carts that we supply products, fortified products. Kenya, Amsterdam Initiative Against Malnutrition, Corporation, milk fortification, looking there also at market-based milk fortification solutions. And potentially, if you look at Kenya, then it should also be scalable, I assume, to Tanzania, which is also a large milk-consuming and milk-producing country in Africa. So there should be sort of the scalability, hopefully, there. And then if you look at, if you remember the sheet that Steve showed on the very much on the government programs we see in Chile, Purita Mama, women that are pregnant are getting their access to nutritious food, but that's government sponsored. Colombia, micronutrient powder distribution, also there, that goes through doctors, prescription, and then depending on the income level, people can get it for free in pharmacies. So all of the above, all of the 5 different phases that some mentioned, I think are sort of tested. And the big challenge that we all have is scale.
Great, thank you. And on that, I'm sure we'll get back to that issue of scale. We've got a buffet there of things that work and things that need to work better. Kate, you are coming at this from the public sector standpoint, or is that incorrect?
Interesting question. So, Population Services International is an NGO, so we're a non-profit, but we primarily work in the private sector. So that's something that always catches me off guard when NGOs start talking about the private sector, but that's good. Anyway, sorry to cut you off there. Well, essentially that's what I want to say, because it really sets PSI apart from the vast majority of other NGOs. And the reason why we work in the private sector is, I know there's been talk about how people are starting to talk and lose this taboo about working with industry, but the reality is PSI has been doing this for more than 40 years. We were set up as a social marketing organisation. Primarily, we focused on family planning and reproductive health, but we have since expanded the agenda and we deal with a much broader portfolio of health issues, and we're now moving into nutrition. Why we're moving into nutrition relates to something that was said in the previous panel about don't silo health issues. Well, we agree, and we're moving into that way of thinking as well. So where we already deal with malaria, HIV, diarrhea, we acknowledge that undernutrition is 1 in 3 is an underlying cause of child mortality, and so it impacts on everything that we're already doing, so we can't ignore undernutrition. So we're moving into that area, but I must just say it's a very new area, or fairly new area for PSI. I think we're working in about 7 or 8 countries right now with a number of stakeholders, GAIN being one of them. A couple of examples, you asked for cases. I guess the ones that I would like to mention are Kenya, where we're working on industrial fortification. So in that context, our role has been to design the logo and to promote the logo. But we work with GAIN and a number of different parties in that context. So we do the industrial national scale stuff, but we also do product development. One of the things that needs to be understood about PSI is that we operate at scale already. So we have this NGO kind of approach in some ways, in that we are primarily focused on the beneficiary, it could be called, and there's been a lot of talk about beneficiary or consumer. I know we're not supposed to have PowerPoint slides for this, but I've asked for one slide just to demonstrate to you what PSI does. So cue the guys at the back. I just want to show a picture of the archetype that PSI uses. Could you chuck that slide up for me? Thank you. So I'd like to introduce you to Sarah. This is the archetype that PSI uses in a very commercial marketing style. She represents all of the men, women, children, and entire families that we aim to work with. And the idea is that we start from Sarah, whether she's a beneficiary or a consumer. We're about, or the approach that we take is called total market approach. That's what we've called it. That means that in an ideal world, we view that Sarah should be able to choose between the public sector and the private sector for herself. And irrespective of which channel she chooses, she should get appropriate healthcare for herself and for her child. So we start from Sarah, and whatever it takes to get her health is the channel that we take, and therefore that means that we work in the private sector a lot. So we're definitely one of the hybrid models on the presentation. We very much sit between the public and the private sector. We work with all stakeholders. And in terms of achieving impact, I think one of the things that I have to talk about is what we call our Delta model. There's a lot of jargon, but this is essentially our marketing process. So the way that PSI does it is we do a situation analysis. We look at what is the health context, what are Sarah's needs. We look at her internal environment. What is her perception of this health issue? What products, what does she desire as a solution? What channel does she want to go to? We look at who are the decision makers in that field. Is it Sarah who's making the choices? Is it her husband? Is it her mother? Is it her friends? Is it her health practitioner? We then look at the external environment, so we look at the policy environment, and we work very closely with governments in all the countries that we work in. And then we take all of that information, the situation analysis, then moves into developing marketing objectives. And these we categorize by price, product, place, and promotion. So we really apply the commercial marketing model in how we then create programs that we implement. And I think that's really essential to scaling up nutrition. So we do this, and the final point is about research. It was mentioned a bit yesterday. It's not been mentioned enough, I think, the fact that we really need to monitor and evaluate what we're doing, not just for accountability to those who are funding the program, certainly in the donor context, but also in order to evaluate the impact that we're having and know whether we're doing the right thing. So finally, I just want to mention, speaking to the scale point, PSI, we take this approach. People don't necessarily know who PSI is because a lot of times the brand that we create, the products that we develop, are given local names. They're very localized. You don't see PSI branded on everything. And we do that on purpose because we want it to be very local. So, but the reality is that we work in 69 countries right now with the world's biggest social franchising organization. In Pakistan, where we have the Green Star social franchise, they have 7,000 private providers, outlets, that is distributing multi-nutrient supplements. So we definitely can scale up nutrition. And I think that it's all about partnership. So my final point is definitely partnership is what it's all about. We have the people on the ground. We have the knowledge on the ground. We know Sarah. And we know how to reach Sarah. But everyone has something to bring. So the advocacy and the expertise that's in the private sector. We have currently 11 public-private partnerships. And within that represents about $24 million of funding. Our annual budget for 2012 was about $700 million. Pretty big. But this $24 million includes in-kind funding. And that is really essential. Funding's good, but the in-kind, the technical support that we receive from private sector has been essential as well. So.
Great, thank you, Kate. We'll leave it there. Yasuhiko, your thoughts on what you've heard so far, but also your experience.
Yeah. Okay, so our company, Ajinomoto company, has a project, in kind of pilot project for social business in Ghana, focusing on this 1,000 days, or more specifically, children nutrition improvement or children aged 6 to 24 months. Okay. So together with various partners, including GAIN or DSM and local partner Yedent, and also financial support from JICA and USAID, we are trying to develop and distribute a product, which is a nutrition supplement, which can be used for the traditional complementary food, which is corn-based porridge for children. So the concept is by using that supplement, children can get enough nutrient for to overcome this stunting problem and so on. And basically, we think there are three challenges for this project. One is the product, second one is the distribution or delivery model, the third one is scale up. Okay? So about the product, the key issue is how can we make the affordable and acceptable product to reach the target population. Affordable means that because we need to produce very small package, 15-gram package, and then distribute to the target population in the rural area. So the cost of product itself, the product is actually made of locally procured soybean flour and also amino acid, which is our expertise, and micronutrient premix and some sugar and oil. Okay, so not just this raw material, but also the package itself has a cost. So how can we make affordable product, and how can we deliver this to the target population? This is a challenge. Also, this product should be acceptable in terms of taste and flavor for local population, because food culture is basically in every country very conservative, so we have to respect their traditional culture. And the second point is distribution or delivery model. So how can we reach the target population, and how can we deliver the nutrition message so that mother can understand the importance of nutrition, and the mother can invest for the nutrition improvement. That will need a kind of behavior change. So we are trying to cooperate with NGO and also the social marketing company to create this behavior change. And third challenge is, I think, scale up. Because this particular segment, that means 6 to 24 months because the food consumption is quite small, so the volume itself is quite small. So this is very big challenge in terms of the commercialization, because if we cannot reach certain level of volume, it cannot become sustainable. So how can we quickly scale up this is a big challenge. Okay. So, and also, if we can apply similar concept to other age group, which includes school children, it will become much more easier to scale up to the certain sustainable business model level. So to achieve this scale up, I think we will need to have a collaboration with various partners, which include aid agencies and also the NGOs and so on. So these are three challenges we are now facing. Our project is now in the study phase. That means we are trying to establish business model. And our goal is to establish sustainable business model.
Great, thank you very much. Yasuhiko, now I'm trying desperately to resist the most obvious question to ask, which is how do you scale up nutrition? But a few things have come out of what each of you have said, and I'd like to ask one or two questions before we get people involved from the audience. And Fokko, you made the point about preaching to the choir. You also made the point about, most of the people involved in this debate are probably within this room, which is a worrying situation. And Kay, you asked the question, well, why nutrition? And then made the point that the key here is partnership, as did you, Yasuhiko. And I'd like to phrase a question around that. One is, why nutrition? Well, to some extent, why not nutrition is the answer, because if the difference between a life of possibility and a life of misery is what happens in those first 1,000 days, it's a no-brainer. That's something you need to take very seriously. But of course, it is one of those things that's very difficult to get your head around, i.e., well, okay, if we agree that this is a crucial intervention, who exactly needs to be part of this? Partnership, we all agree on, that's fantastic, it's great, but exactly how is that defined? What partners need to be part of this movement, part of this debate? Who's currently missing? But also, where do you draw the line? Because it is an issue that literally affects everything. You could argue everyone needs to be involved, but that isn't particularly practical. I'd like to put that to the whole panel. This question of, well, what does partnership need to look like? What's missing? And how do we get to the right situation? Which then, of course, will also address the issue of scale, because once we have the right people involved, it should be a formality. Who would like to start? I'd like to get... yeah, please.
Okay, I think we're looking at impact in the first 1,000 days. I have been asking myself some question, and I think that question could also be posed to the SAN lead groups in the various countries. For instance, if you look at the wealth quintile of Ghana, you have about 60% of the population in income C and D that you can reach with direct distributive, because they have the resource to buy. About 30% who are the very, very base of the pyramid. How do we reach them, and how do we get to them? So I think the partnership that we are looking at in the first 1,000 days, that is from the night that the baby is conceived, or from the afternoon when the baby is conceived, whether the mother has an income to afford or cannot buy, what are the partnerships? For me, this is a critical question that has to be answered. And this is where both the distributive trade and the non-distributive trade become crucial. How can the various health institutions identify those segments who cannot afford and meet them with that charitable need? The Minister for Ireland, Trade and Development, made a statement. He said 40 years ago, because there were poverty and there was a conscious effort through social interventions to overcome those things. 40 years down the line, most of them have moved from stunting, from mental retardation and everything. Today they are able to afford. So what is the level of investments that governments and donor organizations are prepared to commit to the various sound country-led movements to ensure that intervention at the base of the pyramid? Then those who be able to buy from D, C, B, and A will there. So the partnership that I think we should aim at achieving the first 1,000 days is how can the very base of the pyramid not left out. Other than that, in the next 10, 20, 30, 40 years, that problem will not only exist, but will more than quadruple. And it will be a menace on society. So the answer to your question is, what partnership should we look at? Not only partnerships that will lead to production, that will lead to marketing, but partnerships that will also ensure that no one is left behind in reach of nutritious complementary food for maternal and infant young child.
Now, I suspect no one will disagree with the sentiment. How do we achieve that? Who would like to maybe comment on what Sam just said?
It's very much about complementary competencies. So if we look at a country, then, and if we look at a challenge, you need to think across the silos. Forget about private sector, forget about public sector, forget about civil society for a minute, but look who has things to bring to the table. So if we turn around, we say the goal is we want to eradicate malnutrition, then we need to look at it on a country level. And my concern is with the 33 countries that we've picked up so far in Sun, is that there is no focus. And we're sort of overeating ourselves if we're not very careful. So I would plea for getting things done and don't spread too thinly. Build coalitions with complementary competences in mind. We know, and that's also what Sam is saying, is that it's of course a poverty issue as well. But we need to start somewhere. So if we break through that poverty cycle, by improving food, we improve learning and earning capabilities, and we reduce future health cost. That is why the Copenhagen Consensus says if we invest $1, we get a $30 return. And that's where that comes from. But that's of course an investment in a future to break that poverty cycle. So that money needs to come from somewhere to break through that. Let's be honest. I mean, if you see what the sort of amounts of money we've spent in the last decades on development aid, and what it has brought us, I think that the efficiency and the effectiveness of the euros and dollars and yen, whatever has been spent, can be improved. And this is, I think, the moment when budgets are under pressure to improve it and take up the challenge and say, we need to do more efficient and more effective. We bring together the different partners with similar goal, with one goal to eradicate malnutrition, and then look at the ways of moving forward to break through that poverty cycle. And there's many examples. I mean, if you look at China, which of course is no longer a poor country, but if you look at China and some of the stuff that has been done there, I mean, I see Amway here, I mean, huge reach that they've been able to create. They're looking now at South Africa with a similar setup. So there is opportunities, and I think we're getting there, but let's focus, let's get a couple of things finished before we move to the next one.
So very important message there, yes?
The topic is about how to reach the poorest of poor. And for example, in our project, we tried to set the price of that package to be something like 10 US cents per package, which is one day consumption for one child. And this 10 cents per package is probably acceptable for the southern part of Ghana, which is less poor, but not for the northern part of Ghana, which is the poverty, where the poverty level is much higher. So in that area, maybe it's not easy to just distribute it in a market mechanism. So in this case, we will need to think about some hybrid model donation and some market mechanism. That's what we are thinking, and we are talking with donor agencies.
Kate, you said earlier that it's all about partnerships. I'd like to just push you a little bit further on that and ask the question, well, what does that really need to look like? Who is in those sorts of partnerships? Do you agree with what you've heard so far? Is there anything else you'd like to bring in?
Yeah, absolutely. I mean, the situation you just described in Ghana is exactly the reason why you need a total market approach. You need to be starting from Sarah and seeing what she needs in context. And in terms of partnership, I mean, there's a role for everyone. I think it's pretty clear. I don't know, and maybe it's because we're preaching to the converted. What everybody can bring to the table. The enabling environment has to be there for us to move forward. So the role of government is absolutely critical. But then that also feeds into the public health sector and ensuring that Sarah, if she can't afford to go to the private sector, can go to the public health sector. The private sector, absolutely essential, because we know one of the problems with public health sector, and the reason why we work with the private sector a lot, is because of coverage. So, in many scenarios, Sarah can't access the public health sector. So we need to work with the private sector because that's where she's going. And the role of the NGOs, well, and civil society, we know Sarah. We know how to understand Sarah and how to interpret and how to identify what the challenges are going to be along the way. So I think you said who should be at the table, who should be involved. Well, clearly, we all have a role to play. I think the bigger question is how to incentivize everyone to be involved, because we all have barriers to involvement. For the private sector, there's very little profit in this. I can see that, so how are we going to get that momentum? For the government, a lot of different reasons why. From our perspective, funding. We can't just expand what we do without a donor. So that's our one reason why we can't do this, and that's improving in the context of our nutrition work, but scaling up depends on people funding it. So I think partnership is essential, but who's going to be at the table in the roles is less of a question as to how to get them at the table.
Who's missing at the moment? Is there anyone missing?
Sarah.
But building what was said is distribution is critical. We all agree on that. And that's, again, about the complementary competencies. In some cases, private sector doesn't have the outreach that, for instance, a World Food Programme has. We cannot reach refugee camps. We don't have a distribution network which is such that it goes all the way out in some countries. In other countries, we have a better network. So let's not get fixed on one or the other. Let's look at what is needed in the local context. That is the most critical thing. Who has the best papers to bring to the table? That's the one involved. We don't get a fixed format in every country. This is the fixed format and this is the template to go in. So that we need to get it from the perspective of who has actually something to bring to the table. The funding is critical, but I would say, treat it as a program. That means it needs to be ending. So we need to put somewhere a stick in the ground when we say within a certain period, and that could be still a long period, but let's at least now make that agreement in whatever amount of years we feel then it should be market-based. So then we should have an exit scenario, it should be picked up, it should be commercial, and let's work towards that. That means create the consumer, get the understanding around Sarah, but also let's educate Sarah, because to a certain extent there we see that there's a lack of education, understanding of what actually the benefits are. Again, that could be sometimes pre-competitive. Let's also consider that, because it's a huge investment that we are all doing, and if we do it together, we might reach all our goals, and not some of us reach our goals, or none of us reach our goals. And that way we hopefully sort of break through that cycle and find an end date when we don't have to support the poorest, because hopefully we will be able to get that economic incentive. Then we still need to focus always on emergencies. If there's a crisis somewhere, that is a complete different story, which we also need to deal with, but that we can take that separately.
Great. unless anyone else wants to comment on that, according to my stopwatch, we've got about 10 minutes or so, and I wait to be corrected by the organizers. No one's complaining. Okay, I'm going to say about 10 minutes, 5 minutes. Okay, 5 minutes. So let's try and squeeze in 1 or 2 questions. Does anybody have a question or a comment or an observation? Yes? The gentleman just back there.
Thank you very much. I'm Wilbert Lori from Tanzania. In my view, I think there is no single solution to the view of 1,000 days because, first of all, if you look at the situation in Tanzania, for example, the 70% of women who are going to give birth to the children who are stunted, they are not going to be reached by the kind of single formula of saying that we are going to establish a market, a processing plant in Dar es Salaam or wherever. So in my view, I think we need multiple approaches. That particular one, which is happening in Ghana, is marvelous. It's going to make certain segment of the society who will be able to buy. But also, what about those women who actually are more vulnerable? The window of vulnerability for the children and women in the rural setting is even more wider because the purchasing power is very small. So in my view, then, I think it's important, in addition to what is being proposed, we need to talk about, to support the women groups who are doing the blending, because blending of maize flour, which many of us in Africa do, with soybean, with maize, with groundnuts, we need to support them. So the appropriate blending needs to be prepared. That means need guidelines, which can be very useful for the women. And thirdly, the most important one, monitoring and evaluation, because we are on what premises have we started? And how are we following up? Who are they affected? How are we measuring whether indeed we have an impact or not? So these are more questions than really it needs holistic approach. Thank you.
Great, thank you. Anyone else with a very brief question? Yes, gentlemen, all the way at the front to the left. Very brief, please. And if it is brief, then we can take 1 more. If not, we'll have to go back to the panel. Yes, please.
Just a brief comment. It's Lewis Temple here from IDE. In addition to the potential for the private sector to reach scale, there's another real contribution they can make is to support the development of genuinely aspirational products for the poor. And not just focus on the needs, nutrition needs for these people, but also what their aspirations are, and to develop products which really people not only need, but they also want.
Thank you. And I'm going to risk it and take one final question. I'm probably going to regret it. Yeah, the microphone's right there. I'm probably going to regret it, but let's see.
Okay. I introduce myself. I'm in charge of bioorganics nutrient systems in Nigeria, where we do micronutrient premixes. My question is, if every 6 seconds one child is dying, why does it take donor agencies 6 months to process grant applications and loan applications? Can they shorten it? Because I haven't heard the word urgency in the discussion. Urgency. There is a need really for urgency in this matter. Thank you.
Great, thank you. Would anyone like to comment on anything that's been raised? Yes, Kate, please.
One of the things that I wanted to say earlier is how brilliant it is to have the momentum that a group like this can create. Because absolutely, the urgency is a matter. And it was something that was mentioned this morning. There was in one of the keynote speeches, the statement that grassroots, that's where the movement begins. I think that's true, but it could also be argued that it needs to be snowballed at the top as well. You know, if for the policy environment to be enabled, there needs to be pressure at the top. The donors will fund where the priorities are, where there's consensus on priorities. So I think this is really key to pushing that urgency. It's very difficult to push that urgency at the country level. So yes, it depends on Sarah, but it also depends on global pressure, I think. And to speak to just very quickly the point about aspirational products. From our experience, one of the programs that we ran in the Pakistan example again, the Green Star, we actually found that when it was marketed, multi-nutrient supplements were marketed as a consumer product, it really needed a major communication promotion campaign around it. When that campaign stopped, demand fell. And then when we looked into it, we found that actually Sarah was wanting the product to be prescribed by a health practitioner. And it had to be remarketed as a pharmaceutical product. So it depends on the context, I think. I'm sure that that's very true in a lot of circumstances, but not necessarily. So.
Yeah, but I think then we haven't been able to make it an aspirational product. So
Yeah.
I think that's missing. So I agree that aspirational products, that's why I think voucher systems, if we talk about beneficiaries, for instance, is very interesting, because then you can have aspirational products and then have, and that saves you probably long-term on the cost of marketing. Yes, the urgency, absolutely true. It's not only about donor money, but it's also a plea I think that we have to make, is to make sure that the nutrition community sort of comes to a conclusion what we actually should be doing and what not. I think there's also an urgency needed in that space. So urgency is absolutely the case. And yeah, I think that looking at the first question, there's of course, yes, M&E, I fully agree. Yesterday we also had that discussion about how do we make sure that we have true impact of what we do. That's a fair question and a fair ask, and I think that fits in the building trust issue that I mentioned earlier. So I think that is an important issue where we need to see how we are making sure that we promise in that respect really on, or we deliver really on the promise that we are making.
Great. Yasuhiko, and then Sam, real briefly.
I really agree that the product should be aspirational, and that means that mothers should feel happy and proud of investing for the nutritional product. And in that area, I think we, private sector, can contribute much.
Great. And Sam?
I think has impact be achieved? Yes, I think there's been some impact. Because, for instance, in Ghana today, if a pregnant woman is going to buy oil, he will look for the Fortify logo, sponsored by Gain. So all oil companies are aspiring to get on board. So mothers are getting what hitherto they were not getting. Same with flour. I think, again, in wrapping up, there is no question that companies are consciously trying to get to the market with partnerships. The issue now is those who cannot afford, how do we bring them on board? And like my colleague from Tanzania did said, in crafting our company strategies and company models, we should try to ensure that because they cannot be given free goods forever, we empower them maybe along the value chain. So in the medium to the long term, they'll be empowered and they can come into the marketing phase to buy their own products. So in short to medium term, it's okay. Long term, let's empower the base of the base.
Right, great, thank you. I'm getting the signals that I have overstepped my mark. So I'm going to keep the summary very brief and really just echo something that Fokko said earlier, which is a message that I would argue doesn't apply only to this issue, but pretty much across the board when discussing all things development, which is focus on what works, and that really should be the only question, i.e. what works and who's good at it. Never mind what we think of each other. As long as they're not criminals, hopefully we can figure out a way to work with them. On that note, I am going to have to wrap it up. Thank you very much to all of our panelists, and thank you very much to the audience, and thank you to everyone for being so concise.